Hello, Dr. Amit. A very good evening. How are you doing?
Good evening, Shil. How are you?
Doing very well. And welcome to all our attendees. Thank you for joining us this evening. I'm Shriyal Setumadhavan, the Executive Editor of Aesthetic Medicine, and I welcome you all to the Aesthetic Medicine Digital Series. Dr. Amit Luthra has joined us today as our esteemed speaker, and his session will focus on the fillers for the lower face, the cuts and the squares. And I will take this opportunity to introduce him with a few more words. Dr. Amit Luthra is a dermatologist from Delhi with special interest in aesthetics and an experience of more than 15 years. He heads Ishira Skin Clinic in Delhi. He completed his MBBS from the Armed Forces Medical College, Pune, and DNB Dermatology and Venereology from Delhi. He is a member of European Academy of Dermatology and Venereology, Indian Association of Dermatologists, Venerologists and Leprologists, and Cosmetic Dermatology Society of India. He is the invited faculty at major international conferences such as IMCAS. He has also been in the forefront in lecturing and training new doctors. Once again, Dr. Amit, thank you for being with us this evening.
Thank you. Thank you very much.
And for all our attendees, if you've missed any of our past webinars, it's all available on our website. All you need to do is log on to aestheticmed.in and you would have all the recorded sessions. Going by what we follow every time, at the bottom of your screen, you would find two options, one of a Q&A box and one of a chat box. The chat box is for any feedback or suggestions that you would have for me and my team for aesthetic medicine. Please key it into the chat box. For any questions that you have for Dr. Amit for today, please key them into the Q&A box and he would take them up at the end of the session. So the chat box is for aesthetic medicine and the Q&A box is for Dr. Amit Luthra. With that, over to you, Dr. Amit.
Okay, thank you, Shreya. Good evening, friends. I'm Dr. Amit Luthra from Delhi, and I'll be covering fillers for the lower face, the cuts, and the squares. Shreya, everything is fine? It's visible, the screen?
Yes, yes, it is.
Okay. Okay, so I'll be starting with the presentation, and what we'll do is we'll have a half an hour of, or maybe 40 minutes of the lecture, and then we can look at answering some of the questions that are coming up. In fact, we had 4 or 5 questions that were sent to us earlier as well. So we'll try and cover all of them. So when I say fillers for the lower face, the cuts and the squares, what I mean to say is it's basically how we differentiate between the female lower jaw or the lower face and the male lower face. So you have to look at different aspects of the male and the female lower face, and accordingly you got to treat it. But you should understand the basis or the basics of the lower face treatment. So this whole lecture would tell you how to start from the beginning and how you should end up treating the lower face. Oh, it's not moving, Shreya. Okay, when we talk about the lower face, there are certain differences. Remember, when we've been taught that you should do the mid face first. Now, in the mid face, where soft transitions are there, they actually make the aesthetic ideal. But as you move down to the jawline, it should have a relatively sharp and angular transition to the neck. So there's a difference when you're treating the mid face and the lower face. Mid face should have soft transitions, especially in a woman, but when you come down to the lower face, especially the jawline, you should have more sharp definitions and more angular transitions to the neck. So you have to understand what filler to use where. In fact, there was a question before the session started. Somebody had put in a question, what filler should be using in which area? So when you are kind of trying to volumize the area, like you're injecting into the chin or you're trying to inject at the angle of the jawline, you would be using a volumizing filler. But my personal recommendation is when you have to do the pre-jowl, the post-jowl, or for that matter, the ramus of the mandible, you ought to be using a filler which has a kind of a robust quality in it. So it gives you a sharp contour. If you put in a volumizing filler, sometimes what happens is it adds bulk to the jawline and the patient may not be happy. So this is one of my patients, and this is just to show you how you can achieve the exact parameter or how you can achieve the exact lower face contouring. And this is before and after. I'm not telling you what I've used. I'll keep that for the last, and in the end, I'll come back to that same patient and discuss how you should treat such a patient. Now, this is how she came to me. She was very unhappy. She did not have any semblance of a jawline, and this is what we tried to achieve. But this is not the final picture. I'll show you at the end what the final picture was like. So when you look at aesthetic patients, when they come to us, they always present, especially when it comes to the lower face, they present to us with a loss of continuity, and that continuity is missing, unlike in the youthful jawline, which is a straight jawline. And you find that with age changes or aging changes, there is jowling in our aesthetic patients. So if you look at the figure down here, this is a typical jowl that a patient would present with, and this is worsened by the attenuation of the mandibular septum, which results in the superior and the inferior jowl compartments kind of descending down. Remember, when we talk about the fat compartments, we are talking about superficial and deep fat pad compartments. The jowl fats are part of the superficial fat pad compartment. And as we age, this particular fat pad compartment descends down, and also sometimes it becomes more pronounced. So that's why you have this kind of a jowling that you see in this particular patient here. Now, how do we treat it? If you look at the basis or the simple treatment option that you have to do, imagine you have a string which has become loose. So if you tighten it, if you stretch the string from both the ends, it kind of becomes a straight line. So that is the whole methodology that we are going to talk about in the jawline treatment. So what you have is basically accurate placement of the HA dermal filler. It should be placed at the mandibular angle. You place it in the chin. Now these are the first 2 points because you want to stretch the string, and then you come back and you do the pre-jowl and the post-jowl. This is called the peri-jowl region treatment. So this is pre-jowl, this is post-jowl treatment. So all these 4 stars are the points where you should be injecting in the jawline. But as we go ahead in the lecture, you'll find out that the treatment does not start here. The treatment actually starts in the mid phase or in the upper phase, and I'll show you in the later slides how to go about it. So when you're considering the lower third treatments, as I said, the recommendation would be of revolumizing the upper and the middle thirds of the face first. Remember, any patient who comes to you with the lower face issues, she says that she has a jowl, she's not happy with the jawline, you should not jump on and treat the jawline. Look at the upper and the middle thirds of the face first. Why? Because this provides superior volumetric support to the jawline. And the key areas to consider are the temples, the cheeks, and the preauricular region. So this is what I've shown here. So if you have a person who wants the jawline treatment, you don't start with 3. You start with the number 1, you go on to number 2, and then you come down to number 3. Sometimes you may not need to do the temples because the patient already is quite full here, or the patient does not have a budget. But the recommendation of 1 is always there. In this one, I'll further segregate how you should be doing it on the mid phase, how you should be injecting in the preauricular regions. Now, this is an example of a lady, a young girl actually, who wanted contouring of her face. Now, in this case, we have not done the jawline treatment. What we tried to do is we've tried to actually shape her. This is the picture before, which you see on your left, and this is after. This is only with the mid-face treatment which has been done. This is not with any jawline injection. There's no particular chin injections. It is only mid-face injection. So we are trying to contour a face. So by injecting into the mid face, you have actually ended up giving a almost a triangular or an oval profile. This is an older patient. Now, if you look at the picture on the left, she's quite square here, as in all the skin has lost its elasticity and she's sinking down. So you notice carefully, she's got these mentolabial folds. She has this jowling here. The skin, the cheek is virtually flat. She has a malar festoon here, and she's got a very kind of prominent nasolabial fold. This is how she looks immediately after. What you have to notice in this picture is that the profile, the contour has changed. She does not look that square. She seems as if there's something's been pulled up. Again, no injections in the lower face have been done. No injections in the chin have been done. These 2 slides that I showed are basically preparations for the jawline injections. So this patient actually achieved from almost a square profile to almost an ovalish profile. Remember, for a female face, the ovalish profile is the best option. And if you look at this slide, this basically talks about the different contours of the face. And it can be oval, it can be round, It can be square, it can be triangular, it can be inverted triangular, it can be rectangular and oblong. Of all these seven different varieties, the oval is considered as the best option. Unless, of course, you come from the US, where in some areas they want a squarish look. Some of the ladies there want something called a Texas look. So you have to ask your patients, sometimes they would want a different kind of contouring of their faces as well. But in general, if you talk about beauty for a female face, this is what we are trying to achieve. So when we talk about injections, there ought to be a guide to us. And this particular MD Codes guide is a wonderful tool. This is just a kind of a suggestion. It is a landmark as to where all should you be injecting, in what planes, and then you can have your permutations and combinations. So this is the MD Codes of 5-point jawline reshape. I'll tell you about the MD codes in my lecture, and later on I'll tell you how I've modified the MD codes and tried to do things a little differently at places. So in the 5-point jawline reshape, what it talks about is the points are labeled as JW, basically for the jawline. So you start with JW1, which is at the angle, the mandible angle. Then you have the JW2, which is the preauricular area. Now remember this preauricular area because this is very important. And in my practice, I've realized this is probably the most important injection. Though it shows the injection from here, my preauricular comes from here, as in I start from the anterior border of masseter and I do a little fanning all across into the preauricular area. And I'll show you the video. In fact, the video that I have is not for a jawline, but for a preauricular filling, which I feel is a little tough. And especially for beginners, when you first start doing it, it's not easy to do the preauricular filling. So once you've done JW1 and JW2, then you move on to JW3. Now, what is JW3? JW3 is in the mandibular body. Now, remember the jowl that we talked about is somewhere here. So JW3 is basically a post-jowl injection. Why is it in red? Because you have the facial artery, and we'll talk about it. JW4 is the pre-jowl. So you have the jowl here, the pre-jowl sulcus. So there was this swelling or the jowling that you saw, and there was a little hollowness before the jowl and after the jowl. So this is post-jowl treatment. This is the pre-jowl. And then you have JW5, which is the chin apex, which I mentioned earlier that you have to stretch the string from both the ends. It's very important. So as I mentioned, the JW3 is red. Why? Because you have the facial artery coming in. So it starts from the anterior border of the masseter here. If you notice, it has a tortuous course and goes up, and then it has branches, superior labial and inferior labial, and then it goes up into the mid face and gives off the nasal branch and then becomes the angular artery. So this is the area where the facial artery is on the bone in the anterior border of the masseter. So it's very important that this injection has to be done with a cannula. You don't use a needle and you don't go down onto the bone. I'll tell you what injections are to be done on the bone, that is supraperiosteal, and which ones have to be in the subcutaneous plane. So let's start with the JW1. Now, JW1 is probably the most important injection if you talk about a male jawline. So if you notice in this figure, we are going straight in at almost right angles, and this is with the needle. There is a bolus and it is on the bone. This signifies it is on the bone. What is it going to do? It widens the face. So you have the masculine looking results or the typical male square jaw. And that's why the title had the squares. Most of the men who come in, they want a typical model look, which would be a square look. Now, the same thing if you do in a lady, in a woman, if you notice the angle has changed. In a male, it was 90 degrees onto the bone. In a female, it is almost pointing towards the ramus of the mandible. Why? Because in a female, you want to achieve a cut at the jawline. You don't want to give them a square look. So this one would lift and define the mandibular angle. Again, you use the needle, you give a bolus, and it is in the subcutaneous plane that you're trying to do. Now, my contention is when you're playing around in this area, it is always better to be safe. And for safety purposes, what I do, I more often than not use a cannula in this area. Because when you are a beginner, or for that matter, even if you're a trained person, there are times that when your needle might go a little deep. Remember, this is a danger area because you have the parotid gland. And if you're going deeper, you might also hit the nerve, the facial nerve, which is branching out from below. So be extra careful. Recommendation is to use a cannula in this area. So if you compare the two injections, The male injection is vertically in, this is at 90 degrees. Also, the bolus for a male can be from anywhere zero point 0.5 to zero point 0.8 ml up to 1 ml also. And this is a volumizing filler that we are going to use. In a female, on the contrary, if you notice, the angle is towards the ramus of the mandible. So these are important differences that you have to look at. Now, when we're talking about the bones, it is important to understand what are we saying, and this figure would kind of signify. So when I'm injecting in the JW1, this is the area I'm injecting straight in. When I have to go for a woman, I'll be injecting almost towards the ramus or behind the ramus of the mandible. So this is the area I'm trying to target when I'm trying to target a female jawline. Then we move on to JW2. This is preauricular area. As I mentioned earlier, this is probably the most important point, and it is your wish how you want to do it. Whether you want to do it straight away like this, as in the figure with a needle, I would again suggest you use a cannula. You can come from the angle of the mandible and go straight up in a male and go at an angle in a female, or you can use the anterior border of the masseter here in line with the outer, the oral commissure, go straight in here, and from this area you can do a little fanning. This particular point that I'm talking about, which is in the anterior border of the masseter, is also a point from where you can actually reach the cheek and turn it around and do the other areas as well. So for me, this preauricular injection changes from here to probably the preauricular shot from here, or I can go down to the angle of mandible and use a cannula and come up. The plane of injection is not on the bone. This is in the subcutaneous fat, and of course you have to be careful about the parotid gland. Moving on to the JW3 point. Now this is to improve the definition of the jawline. Again, you use a cannula. You can use zero point 0.2 to zero point 0.5 ml. It says a volume of a filler, juvederm voluma, but I would suggest in this area when you're doing a subcutaneous injection, go in for a more robust filler. Juvederm voluma tends to give you a little extra volume, so it gives you a heavy jawline. My suggestions are in this area to use a filler like Juvederm Ultra Plus. You can even use something called Bolletero Intense, or if you're a Restylane fan, you can use the Restylane Perlin variety, or which is now called the Restylane Lift. Now moving to JW4, which is basically the pre-jowl sulcus. Now this is, remember, the arrows are pointing towards the jowl. My suggestion is when you're trying to treat in the pre-jowl and the post-jowl, make sure that the arrows are away from the jowl. So if the jowl is here, my arrow would go towards the chin. If I'm doing the post-jowl, I'll go towards the angle of the mandible. Again, my suggestion is use a cannula, though it says you can use both. My preference is to use a cannula and put it in the deep subcutaneous plane. Remember, when you're treating the fat pad compartments, you have to be careful what particular fat pad compartment are you trying to target. Are you trying to target the superficial one or the deep one? So you have to remember that as well. And this is the chin apex. So you inject on the bone. This is to be done with the needle. You can use a volumizing filler like a Juvederm voluma. You can give a little bolus on the bone. So this gives you a good vertical dimension or a chin height. So this is how you would do the jawline. If you have to just do a patient who comes to you with a jawline, you do the mid face and then you come down and do this if you're not treating the upper face for that matter. Now let's move to another important area, which is the 6-point chin reshape. Sometimes there are people who've already done fillers at other places and they're not happy with a particular area. So they come to you for a chin reshape, or for that matter, somebody has a retrognathic chin and you want to give them a little proper chin, or somebody has a double chin and it's because of the retrognathy of the chin, so you want to give a chin augmentation. So chin in isolation can be done according to this, what we have shown here. It's basically called the 6-point chin reshape. You start with the C1. C1 is the mental crease. C2 is the injection here, which is at the chin apex. C3 is the anterior chin here, which gives you a projection or anteroposterior projection. C4 is the submental below. C5 is the lateral lower chin. Now, C5 is basically meant for men again. Remember, there's a difference between a female chin and a male chin, and I'll show you in my subsequent slides what is the difference. So remember, C5 is only meant for men, and C6 is the same point that we discussed earlier, the pre-jowl sulcus or the JW4 point. So these are the 6 points of chin. All of these go together. If you're doing a patient who has no issues of budget, you can actually go ahead and do all these points at one go, but it is recommended that you go in phases. You do your mid phase first, let the patient come back after a month, then you get into the upper phase, give it a month, let the patient come back, and then you start working on the lower phase as well. So when we talk about the chin, we start with the C1 point or the mental crease. You can again use either a needle or a cannula. What is it going to do? It reduces the protrusion of the lower lip. It gives support to the oral commissures and elongates the chin. Again, you can use both a needle or a cannula. It's your choice. My personal preference is to use a cannula because it's more comfortable for the patient. Then moving on to C2. C2 is basically the chin apex. You can use a volumizing filler. The same way you can go onto the bone. It is a supraperiosteal injection. This would improve the vertical dimension or the chin height. And then moving on to C3. Now, this is a critical area. Just like we had other the JW points wherein the facial artery was, you have to be careful at this particular point, which is the C3. Why is it important? Because it is right in that area where you have the mental artery. So remember, this C3 point is important to give anterior projection, but it's also risky. If you go too lateral to the point, you'll probably end up hitting the mental artery, and there can be vascular complications, there can be skin necrosis and other such issues. So when you're injecting in the C3, try and be as medial as possible. Moving on to the C4. Now, C4 is basically the submental injection. So this is used to rotate the chin upwards. More often than not, it will give you a good vertical dimension. But if you have a chin which you look from the down, as in if you look at the patient from down below, sometimes you have chins which are out rolling. So if you want to improve the rotation of the chin, you want to rotate the chin upwards, this is the time that you use the point which is C4. And again, you can use a needle and you can go onto the bone, or sometimes we go into the deep subcutaneous fat compartment and inject there. C5, as I mentioned earlier, is basically meant for men to give them a kind of a broad chin. So this is widening the chin and it gives lateral support. It gives you a more square chin. So this point needs to be avoided in women. This is ideal for men. You need a needle. You can go onto the bone and inject a bolus with a volumizing filler. Then the pre-jowl sulcus, which you already mentioned earlier, is basically to reduce the prominence of the pre-jowl. You can use a cannula or you can use a needle. My personal preference is to use a cannula in this area. Then moving to the last thing in this category of the jawline or the shaping of the jawline, there's something called the marionette reshape. Most of our patients, when they come to us, they complain of this mentolabial fold being very steep. So what I do is I use a cannula or a needle. You can go onto the bone and inject a bolus with a volumizing filler. Then you can go onto the bone and inject a bolus with a volumizing filler. So this is how you can get rid of the mentolabial fold.
Hello. Dr. Amit, your voice is breaking.
Even this has to start. Is it better now? Can you hear me, Shreya?
Yes, yes, we can.
Okay. I'll just change my position.
Yeah, sure.
I'm audible now?
Yes, you are.
Okay, so the last thing that we want to talk about is the mentolabial area, which is basically to get rid of this mentolabial fold that some of the patients would complain of. The injections are done as they are shown here, M1, M2, M3. Some people say that you ought to be injecting in the subcutaneous fat pad compartment. My injection, which is the M3, is on the bone. The other two are in the subcutaneous fat pad compartment. What I do is I use a cannula, and with the cannula from here, I go and do these 3 points. So I start deep, inject this point, come out, and then I go a little superficial and inject these M1 and M2 points. So this is how you can get rid of the mentolabial folds. But as I mentioned earlier, you have to be sure that you've done the mid face, especially the preauricular point, before you got into these mentolabial points. Now, what I'm going to talk about now is in practice, how do you treat it? I know I've kind of mentioned a lot of theory in this, But in practice, if a patient comes to me, how do I treat it? My points are simple. What I do is I start with number 1 point, which is basically in the mid phase. This is the zygomatic arch. I put it on the bone. Some of you are aware of the CK point, so this probably would be around CK1 or somewhere between CK1 and CK2. Then I go down to this area. This is the preauricular area. Now, as I mentioned earlier, you can either come from here and fill this up, or you can do it from the anterior border of the masseter and go in and do a fan in this area. Then you go down and do a little shot at the mandibular angle, which you would not want to do too much in a female. In a female, the point number 3 would probably be around zero point 0.2 ml maximum. For a male, it would be more. And then I go down to the chin, and last I do my pre-jowl and the post-jowl sulcus. So this is how you treat. So this is that lady, and what I've done is I've given shots 1, 2, 3. Then I've done my pre-auricular injections. I've given a little bolus here, zero point 0.2 ml. I've taken my point, the posterior point, post-jowl sulcus from here, where the jowl ends, and I've gone straight in with the cannula. And this is my pre-jowl, which is also covering my mentolabial, and this is just a little point at the chin. So basically, the purpose is to cover all the points. How you do it is your personal thing. You can actually modify the treatment. You can even use one injection point to do the multiple areas with the cannula. But when you're treating patients, remember it's very important to be aware of the vessels. As I said, the vasculature is very important. So what is important is this facial artery, which comes from the anterior border of the masseter right here and kind of has a tortuous course, goes up. So this is coming in line when you're treating the jawline. It is also coming in line the inferior labial branch when we're doing the mentolabial here. That's why when we're injecting here, it has to be in the superficial fat pad compartment. And then you have to be worried about this. When you're doing the pre-auricular injections, you have to be worried about the transverse facial artery, which is a branch of the superficial temporal artery. So be careful when you're injecting. And when you're injecting here in the pre-auricular, you have to be careful that you don't go very deep because the parotid gland is there. So again, just to revise, this is the facial artery here that you have. You have the transverse facial artery. So when I'm treating the jawline, these are the two particular arteries I'm really worried about. And obviously the other ones, as I mentioned, the chin was the mental artery and inferior labial, the branch of facial when I'm working here close to the mental labial fold. So this is the patient before and immediately after. This is how she looked when we did the injections. This is the patient 3 months after. Now, for her, everything was done at one go because she had come from outside. She could not come again and again, so we did everything. Going back, this was how she looked before and immediately after. This is when she came in for a review 3 months after. So, what we've tried to create, she virtually had a jawline which was ending here. She did not have anything in the posterior aspect. So, we tried to create a little jawline for her in the posterior aspect, gave her some in the chin as well to stretch the jawline. And obviously, the mid face and the preauricular has been done beforehand. And this is the same patient before and 3 months after on the other side. And I'll share with you the video, and that is basically of the pre-auricular area. This is just to demonstrate how you should do it. So this is the video wherein you can actually see that I made an entry point. This is the anterior border of the masseter. The patient is lying down, so probably the video is a little horizontal. It is difficult. It becomes really difficult at times to do this procedure because there are adhesions in the preauricular area. So what I would suggest is you enter and you roll the cannula and you stretch from the posterior aspect. From here, you've got to stretch the skin. So you kind of stretch and go in. Be gentle.
Dr. Amit, do you want to maximize your screen? You can show the
Okay.
video on full screen.
Can you see it now?
Yes, we can.
Okay, so this is basically going in and we're just trying to do a fan into this rectangle so that this whole area kind of gives a tangential pull up to the patient. And this is the starter, as I mentioned, for my jawline treatment. And I end up using anywhere from zero point 0.7 to 1 ml of a filler. If I have to use a filler, I would recommend that you use a volumizing filler, a juvederm voluma, because that tends to pull it up. Sometimes for a patient who's quite broad, who does not want too much of volume, I would even use a Volift. I can even use a Bolletero Intense or a Bolletero Volume. And sometimes I've used Perlin as well. So I'm telling you about the different options that are available to lift up this area. For me, this is the starting point if I have to do the jawline. If the patient has already done the mid face here, this would be my starting point. Normally, I give a couple of points in the on the bone here, and then I straight up go on to the preauricular, and then I go on to the jawline area. Temples, if the patient is hollow and there is some issue, I always add that on after the mid face augmentation. So moving back to the presentation. Okay, now this is again trying to show you how it happens. This is a lady again wherein she came in. She was doing fillers in the mid phase. What we have done is we just done 1 ml of a filler into the preauricular area. She had a budget, so we had to divide zero point 0.5 and zero point 0.5. The purpose of this slide is to show that even if you do injection in the preauricular area, your this particular area, the nasolabial and the mentolabial seems to improve. So if you look at the after picture, she has improved. She looks much better. And now I can start working on the chin and probably give her a better jawline. But I've managed to change her contour and change this particular area of her face, the lower face, much better. This is something that you ought to be careful when you're doing your pre-auricular injections, because you're injecting in the superficial areas. Sometimes you might end up with this kind of a superficial filler showing, especially if you're using a filler like Juvederm Ultra Plus or Bolletero Intense. It might kind of show on the face. If you see in these two figures, it takes around 2 to 3 weeks to settle down. If the patient is not happy, you will probably need to dissolve it as well. This is examples of how the patient changes, how we've done different things. Here is a patient wherein we injected the mid face, and we've also done the lower face in her case. This is how she looks 2 days after. This is how she looked 3 months after. So the filler, whatever you inject, takes time to kind of pull up the lower face. It takes time to really set in. So this is the patient after 3 months. And then she came back and she wanted some more touch up. So this is again after 3 months, we put in some more fillers in the jawline, and we put a little bit in the cheeks as well. Another example, now sometimes you have patients who are pretty round and you don't know how to create a contour. So again, the upper face, the middle face are important in this case. We've not done too much in the lower face for her. We just tried to kind of lift her up. So instead of a round contour that she has, we've tried to create almost an oval. And ideally, in such a patient, you would want to use a device as well, because she has a lot of this subcutaneous tissue. You'd want to tighten her up. But she only wanted injectables, as in only the fillers. In fact, given a choice, I would also do the Botox for her and try and kind of thin her out. But she only insisted on fillers. So we've done the mid face fillers for her. And this is how she looks after 6 months. So there is change in the contour. From an oval face, she's become a little, from a round face, she's become more oval and better looking. Now, moving on to the chin. Sometimes, as I mentioned earlier, people have retrognathic chin and they have this issue of a double chin. She has again issues of budgets. She said, I can't spare more than 1 ml. So we've done the chin. There's not a great result, honestly, but we managed to take away this submental issue that she had, and she doesn't show the double chin so much immediately after the treatment. So you can use the filler only in the chin to get rid of the double chin as well. So the differences between a female and the male, we've done the female injections. Let's go on to the male injections. As I said earlier, for a male, the chin has to be more broad as compared to a female. For a male, it has to be a square jawline, whereas in a female, it need not be a square. It has to be a more of a cut that you should be seeing. So if you compare these two figures, this is what I'm talking about. The jaw has to be more square. In a female, it has to be more cut. In a male, the chin has to be in line with the oral commissures. That's why I've drawn these two lines. Whereas in a female, it should be in line with the ala of the nose. So the chin has to be small as far as the width is concerned, so that the female has a good light reflex here. So remember, these two parameters are important when you're treating the jawline and the chin for a male as compared to a female. So in a male, what do you do? In a male, in the mid phase, the injection points are a little different. When we do a female, we do CK1, CK2, and CK3. Whereas in a male, we do it in a right angle. You inject on the bone, but in a right angle to give them a square look in the front picture. You do the same preauricular injections, but the major difference comes here. This is a big bolus. The angle of mandible is a big bolus, and this injection goes straight in instead of at an obtuse angle towards the ramus. So it is straight onto the ramus. And then obviously you do the post jowl, the pre jowl, and you have to prepare the chin as we discussed earlier. So this is a male patient. This is before and after. So what did we try to achieve? We tried to achieve a kind of a right angle onto the jawline. So if you notice, he's got a jawline which is more defined now as a male jawline. This is a different phenomena that I encountered in some young patients. They don't want a complete square. They want this metrosexual jawline. So this gentleman here, his jawline ended here, the angle. He wanted me to create a jawline which was more metrosexual. So instead of giving him a square look straight up, I went and did a ramus injection, or rather behind the ramus, and tried to give him the different kind of look into the jawline. So you can actually have alterations as well. Now, moving to combination of treatments. When you're doing your jawline treatments, you have to combine treatments. As I mentioned earlier, in some patients, you have to use Botox before your fillers. So this lady here has this huge masseter muscle, which we treated, and then we got into the fillers. So we started with Botox for the masseters, then we did the mid-face injections, and then we came down and did the jawline injections. Again, this lady here, if you look at the bulk that she has, she's a good candidate maybe for a energy based device also. This is again a lady wherein we combined treatments. We started with the Botox injections, we did the mid face, and then we came down to the jawline. So that's why you see the contour has changed and she has a better definition of the jawline as well. This is that patient that I showed you in the beginning, and this is how she started the treatment. She came in, and my suggestion straight away was not fillers, not Botox. I started with an energy based device. I have the Altera. So, this is what I did. I did the Altera on the face and neck, and this is 4 months after Altera. So, there was this semblance of a jawline which appeared after 4 months of Altera. Altera is basically a highly focused ultrasound, and the results are not immediate. You see them after 3 to 4 months. So this is the patient after 4 months, and then we started injecting the jawlines and the chin. Now remember, jawline and chin takes in a lot of injections. It's not that 1 ml can do the trick. So we did it in a sequential manner. So this is the first short injection that we've done. We've used around 1 ml per session, and we gradually built her up. She's taken 1 ml in the jawline, and we put a little bit in the chin as well. So it was roughly 2 ml. And this is when she came in after a month of the last injection. So if you notice, a kind of jawline semblance has come in, and we're trying to create a ramus. And this is after 4 ml, wherein we really created this ramus and a proper jawline with a proper chin. Now, if you look at the chin, what I'm not happy with is the chin is projecting too much here. Now, this particular lady insisted on having a kind of a more pronounced chin. You see a lot of patients who are floating around, and there are these weird chins these days. Try and be careful when you're injecting into the chin. My suggestion is not to go ahead and inject 4 or 5 ml, but try and under inject, because it does not look very good. But anyways, this patient was happy. So from here, we managed to get her here. This is with Altera and around 4 ml of the fillers. No Botox was done in her case at this time. So in conclusion, when you're treating the jawline, you use the toxin or your energy based device first. I mean, that's the treatment recommendation. But if somebody does not have a concern, if they do not have a strong masseter, you can straight away go on to your fillers. Fillers in the mid face and the upper face first have to be done. If you're not willing to do the upper face, do at least the mid face. Even if in the mid face, if you have budget issues, do the preauricular injections and then come down to the lower face. Do the angle and the chin first. I remember I told you about the string. So you stretch the jawline like a string, and then you come into the perijowl. The perijowl will be the pre-jowl and the post-jowl, and you inject either subdermal or supraperiosteal. Subdermal is in the superficial fat pad compartment that you're trying to treat. So subdermal and supraperiosteal. When you're injecting your preauricular also, you have to be subdermal. The two figures that I showed wherein it was showing prominently is because I probably ended up injecting a little bit in the dermis, and it was too much of a volume in that particular area. So these are the concluding points and take home points, that you should start with the energy base and toxin, move on to the fillers first in the mid face and upper face, and then get into the jawline. And this is the plane of injection. Thank you very much. I hope you had a good session, And I look forward to your valuable support for Delhi. We are bidding for Dermacon International 2023. Thank you.
Thank you, Dr. Amit. That was a great session. I request everybody to please key in your questions in the Q&A box. Dr. Amit, we already have a few questions in the Q&A box, so you could start taking those. You could stop your share screen first.
Okay, so I'll stop the sharing. Yeah.
Yeah. Yes,
Okay.
and you could see the Q&A box at the end of the screen.
Yeah, so I'll start with the questions. We have Ashutosh Soni who's asking, which fillers do you recommend? I already covered that. We actually use a volumizing filler like a Juvederm volumer at the mandibular angle and at the chin apex specifically. But if you want to inject in the subdermal plane, say pre-jowl and post-jowl, or where you're trying to create a ramus, I would say you can go ahead and use a Juvederm Ultra Plus, even a Vol Lift. Sometimes I've used Bolletero Intense or even Perlane. Then Ashutosh also wants to know any experience on Korean fillers. I used to use the fillers, especially by LG. They were pretty good. They're not available as of now. I've used a lot of brands, but my personal choice remains the Juvederm range. Sometimes I've used the Bolletero range as well. So I would say Juvederm has a good range, so you should probably stick to it. Where are cannula for filler injections? Now, where are cannula for filler injections available? This is a question again by Ashutosh. Well, cannulas are available from some distributors, but most of the time we pick it up at most of the conferences in the exhibition area. But now there are a couple of companies who have these distributors who give the cannulas. Which cannula should you use? You should probably use a 25 or a 23 or a 22 gauge. Don't use a 27 or a 30 gauge cannula because they can be as sharp as a needle. Remember, when we are talking about complications, we are worried about the filler going into a vessel or a vascular complication. So if you're very kind of brisk or very hard with the cannula, you might even go through into a vessel and you'll keep on injecting, right? Komal wants to know point C4. You're talking about the chin injections, right? So the C4 point is basically submental injection, wherein you go below the patient, as in into the chin area, just below. You ask the patient to lift up the chin, and you inject. The purpose is to rotate the chin upwards. You have, if you look at the side profile, or if you take the submental profile of a patient, you'll see that the chin is rolling down. So you need to kind of lift up the chin. More often than not, this is seen in a lot of cases wherein the patients have injected a lot of fillers into the chin. Because of the weight of the filler, the chin tends to down roll. So this point is good if you're rectifying a chin as well. Then Dr. Varsha Mehra wants to know, how long do the mid-face fillers last? The pictures that he has shown, he says the patient came back again after 3 months. Well, the fillers don't last 3 months, they last anywhere from 9 to 12 months. Some of the fillers last up to 18 to 24 months. So the pictures that I've told you is because this patient came in from all those patients that I showed you, two or three who came back after 3 months. They were patients from outside Delhi, so came back for a review after 3 months. So it's not that the filler vanishes after 3 months. It stays for a good 1 year at least. If you're using a volumizing filler, it can go anywhere from 18 to 24 months. And if you keep on adding fillers, the longevity of the fillers increases. Then Dr. Varsha Mehra also wants to know, how long does Altera last? Altera lasts probably for 1 year, and you repeat the Altera again. Then there's an anonymous attendee who says, can you please explain the points of chin injection in female patients where you did 1 ml for the chin? Okay, there we do a straight point, which is into, that is point number one, which was rather C2. The C1 was the mental crease, not that, but you can do the straight point onto the chin, which would be a bolus. And then you do your C3, which is a little higher up on either side. Okay, so these 3 points were used in that particular patient. So we use boluses on the chin to give her a kind of an anterior projection as well. Ashutosh again wants to know maximum amount of filler that can be injected in one person. There's no limit. I mean, the maximum you can go up to probably around 12 to 16 ml in a patient, but there's no limit again. It's not like the toxin, which has a higher limit, but I don't think there's any limit per se in one person. Anu Kapoor wants to know, sir, can we do the pre-jowl with needle? Yes, Anu, you can do the pre-jowl with the needle, but for safety issues, we've kind of shifted to a cannula so that we are relatively safe, but you can always use a needle. There's no problem with that. Anu also wants to know, when you build the ramus in females or JW2, which technique do you follow? While in the ramus, when I have to do the female, what I do is I inject on the angle of the mandible, and that particular point, the angle of the mandible is sometimes that is used to go up at an angle and kind of build up the ramus. Or the other option is when I'm doing the post jowl with the cannula, I use the same injection point and go up and build the ramus of the mandible. So there are two options that you can use. The easier one is the angle of mandible. You can make a little opening there with the needle, and then with the cannula you can go either straight up in a male or at an obtuse angle in a female. Then we have Nada who wants to know, how do you approach marionette lines, please? So I showed you those 3 points. Those are the points that you inject. The injections have to be very superficial or just subdermal in the first point, which is M1. Then you go a little deeper in M2. M3 is deep, or you can be on the bone. So this is how you approach the marionette lines. And as I said, you start first with the mid face, do those areas, especially the preauricular. Even if you have to do the marionette line, please do the preauricular area first. That will give a good response. If you remember that patient I showed, wherein we've just done the preauricular, please do that at least. It will make a good difference to the patient, and the results are much, much more gratifying. Then you have Manas. He asks, sir, can you please elaborate on Jividum series from low to higher concentration of HA? Uh, well, it goes from Jividum Volite, which they have for rejuvenation. Then you have Volbella. Then you have Volift. Then you have the Voluma. Now, this is the Via Cross technology. Then they have the other ranges in the higher cross, which is the Ultra Plus and the Ultra. So there are different types of fillers in the Juvederm range. My recommendation is Juvederm Voluma is very good, and Volift is also a good option. If you want to use it in the under eye area, the Volbella is a good option, but it has to be supraperiosteal injection. Then Ashutosh wants to know, in case of asymmetry, how do you rectify it on the side where more filler has been injected? Well, you can actually use energy-based devices to kind of reduce it if you want, or you can use hyaluronidase injections to dissolve the filler a little on that side. Anu wants to know again, and what amount to be used in JW2 roughly? Uh, Again, it depends on the patient how much you're going to use. My injections into the jawline with the chin is roughly around 4 ml I'm talking about. So I need to see how it works out and how the patient is responding. Point of entry of cannula for post jowl area is basically the post jowl or the where you have the facial arteries, right? Bang at that facial artery point, but you have to do it superficially. You don't go down onto the bone and do it. So post jowl is at where you see the anatomical markings for the facial artery. Parminder Chaman wants to say, please explain about temples too. Parminder, this is beyond the scope. That takes a long. Maybe another session can be done about the upper face. Uh, More questions there?
Dr. Amit, maybe you could look at the chat box. We have a couple of questions come in there as well.
Okay. Somebody is asking here.
You would see a little bit of some chats that I had with the attendees, but there are some questions as well. So
Okay.
um, I think it's more towards the end.
Okay. There.
So do you combine fillers with threads? Smita
Okay.
Ran is asking.
That is a big issue whether you should combine fillers with thread. People recommend that you should not be doing it at the same session. You should probably do your say fillers first or threads first. Some people say you do threads first and fillers first, but remember they are in the two different planes. Fillers, when you're doing it in the mid phase, especially, is in the deep fat pad compartment, whereas the threads are put in the superficial fat pad compartment. So actually, there are two different planes. I usually end up sometimes for patients who come out from outstation to do it at the same session with the same opening. I go deep down in and put in the filler, and then I go into the superficial fat pad compartment and put in the thread as well. But that is what is not recommended because issues with threads are of sepsis. They can always be granuloma, so be careful when you're doing it at the same session.
How to assess what would be best for double chin in a patient? PPC injection or Euthera or filler? Riddhi Arya is asking.
Okay, see if you have a retrognathic chin, straight away you do a filler. I mean, you got to assess the chin first. If you have submental fat, which is an issue, remember Altera is not a device for submental fat. If you see fat, it has to be PPC. But if you have laxity of skin, then you go in for Altera. So this is how you differentiate. My choice is retronathic chin, I'll do a filler. I see submental fat, I'll do PPC and followed by Altera. If there's no fat, loose skin, I'll just do Altera.
Question from Smita Rani again. Approximately how much filler is lost in the cannula?
I won't know that, but yes, you're right there. We might lose some material, and plus, you end up injecting a lot. So there is wastage when you're using a cannula. You're right there.
Rajshri Chaudhary's question: how do you counsel a patient as to when do they need to come back for fillers again if they get injected in a gap for every few months at different areas?
Oh, okay. So what you do is basically you tell them how long the filler lasts, but there's nothing as they have to come back at that particular time. Remember, patients respond differently. So what I've done in practice is I go according to their judgment. Sometimes they come back and they ask for fillers, but I don't see a reason to do it, so I refuse them. But sometimes they do have some little defects that can be covered with an 1 ml. I always put in an extra 1 ml. So the rough parameters that I talk about when I talk to the patient is 1 year with the fillers if I've done the full thing. If I've done part treatments, I can add on more fillers after 3 months, after 6 months. So that is the way I go forward.
Dr. Priyanka Agarwal is asking, pre-auricular area, is it
So yeah,
same as the CK4?
yeah. So Priyanka, this is the same as the CK4, and you can do it with a cannula, preferably. I mean, that is the recommendation. Don't try a needle in that area. But when you're doing a jawline, you can do a pre-auricular from the other side as well, as in you can come from the angle of the mandible and do it. So it's virtually the same area, but in some patients, the pre-auricular might differ when you're doing the mid phase because you'd want to target the CK1 and the CK2 points higher up. So there can be a variation in how big is the area, but it's virtually the same. Yes.
And Dr. Amit, if you just go back to the Q&A box, we have a couple of questions over there again at the end.
Okay.
So I think you left at Parminder Chaman on the
Okay.
temples
So for
question.
Chanchal wants to know for numbing, do you use EMLA or nerve block? As I've noticed with EMLA, patients still feel pain. Well, my recommendation is to probably do an infiltration block with the anesthesia. I don't do a nerve block complete. I actually try and do only an infiltration block. And yes, you're right. With the EMLA, there is an issue. Anu wants to ask, so ramus in female should be at an obtuse angle rather than 90 degrees from the angle. Exactly, you're right there. And can you show videos for other JW points? Unfortunately, I don't have them as of now. Riddhi, sir, in all your pictures, you showed the results were only with fillers or combination of treatment. I've mentioned where I've used combinations, Riddhi. At the end, I showed you combination of Botox with fillers and Altera with fillers. So most of them were with fillers. Also, can the pre-auricular area can be done with needle also? You can, but it is fairly dangerous. I would not recommend that.
Great.
I think that
So
we're done with that.
yes, so I think with that, we're done with all our questions for today. Thank you so much, Dr. Amit. Great presentation, and I'm sure it's helped all our attendees who's joined us this evening. Thank you, everybody, for attending. I had a few questions on, I guess some people they couldn't see the presentation in between, or, because of network issues at their end. The recording of this webinar would be available on our website next week. So you could log on to aestheticmed.in to view it next week. It will be available to you. When you view our webinar, it takes you straight to our YouTube channel. So do not forget to subscribe to the Aesthetic Medicine India YouTube channel. It would keep you updated on all our upcoming sessions as well. And we're also available on Facebook and Instagram. So do not forget to go and like us on Facebook and follow us on Instagram. Aesthetic Medicine India is what you need to look for. Dr. Amit, once again, thank you so much for joining us. It
No
was
problem.
great to
Thank
have
you.
you
It was
here.
a pleasure. Thank you.
Thank you. Take care. Stay safe, everybody. Take
Right.
care.
Thank you.
Thank you. Bye.